Hello, my name is Joshua Dawson. I will be presenting our paper, Hospital Employee Experiences Caring for Patients in Smart Patient Rooms, on behalf of my co-authors, Eden Fisher and Jason Wiese. Before talking about the hospital employees, it is important to first understand the patients that receive the most benefit from staying in a smart patient room. As an example, I want to introduce you to Caden. Caden was a police officer and an amateur motocross racer. In July of 2022, his life drastically changed when he crashed on his dirt bike. The fierce impact caused a fracture of the vertebrae in his neck, paralyzing him from the chest down. Although he has some arm movement, he has no dexterity in his hands or fingers. For Caden, a rehabilitation hospital became his new temporary home for the next few months while he learned to manage his limited motor abilities. For patients with severe motor limitations, in a typical hospital, they must rely on nurses or family members for nearly everything, even mundane tasks like finding something to watch on TV. That brings up a good question. With limited abilities, how do you watch TV? In a traditional hospital, there is a pillow speaker that allows you to control the TV, call a nurse, or turn on and off the lights. But for Caden, this remote is unusable due to his limitations. For patients with severe motor limitations, a sip and puff switch is a common device to activate the nurse call light by using their breath. Now back to the scenario where a patient wants to change the channel on the TV. If a family member is not around, they'll have to call a nurse, so they blow into this tube and the nurse call light is activated. After some time, the nurse will come into the room and the patient will ask the nurse to change the TV channel. The nurse will grab the remote or walk up to the TV and spend time helping the patient find something to watch. Obviously, in this scenario, this is not the best use of the nurse's expertise, but sadly, it is the only option. But what if there is a better way that will allow patients like Caden to control aspects of the room's environment and entertainment without always having to call a nurse or rely on a visitor? Let me introduce the University of Utah Health Craig H. Nilsson Rehabilitation Hospital. It opened in May of 2020 and was built from the ground up with technology in mind. What makes this hospital exceptionally unique is that all 75 patient rooms have smart home technology packages integrated directly into the room, creating smart patient rooms. As you can see from the app's user interface, the media, lights, blinds, door, climate, nurse call, and even the hospital elevators can be controlled directly from the app. And as a quick example, if you click on the media link in the left side navigation of the iPad or on the media icon of the phone app, it brings up the media page. From here you can control all of the room's entertainment options. At this point, I'm sure you are thinking, this device uses a touchscreen, how does that actually solve Caden's problem? Well, the Smart Room app has built-in voice control functionality, and as you can see from the screenshot, the options menu provides example commands to control aspects of the room. Additionally, since it is an app, you can use any common accessibility controller, like a sip and puff, eye gaze, or glass house, to control the app. The different control methods allow patients with a wide range of abilities to have control over the smart features of their patient room. Now that you understand the research environment where we conducted this study and the types of patients that are in a rehab hospital, let me explain the research gap and the questions we are trying to solve. To summarizing the positioning of our research, there is a lot of prior research on smart homes and smart home technology. Additionally, there is a lot of research exploring technologies that are deployed in a healthcare context. However, an SPR sits in the gap between these two bodies of work. On the left side, smart homes are not smart hospitals. Patients, caregivers, and employees temporarily live and work in the patient room. They don't own the technology, they didn't pick it out, and they didn't set it up. So the smart home literature is only partially relevant. On the other side, we know the hospital context complicates the deployment and usage of any new technology. So it is interesting to see how this SPR technology fits, and specifically how smart home technology in patient rooms impacts the patients and employees. Our research explored this gap by studying the implementation of smart home technology directly in the wild of a hospital setting. It is our ongoing collaboration with the NRH that made exploring this research gap possible. Based on related work, we came up with 3 research questions to answer. RQ1, how do hospital employees currently use SPR technology? RQ2, from the employee perspective, what are the benefits and drawbacks of SPRs? What has been done to overcome challenges? And RQ3, what are the employee suggestions for improving the SPR? What are the design opportunities for future SPRs? To answer these research questions, we explored hospital employee experiences of caring for patients in smart patient rooms. For data collection, we conducted semi-structured interviews with 23 hospital employees, including doctors, nurses, occupational physical speech therapists, IT personnel, health unit coordinators, and rehabilitation educators. We recruited 2 to 4 personnel from each job type. Our interview questions focused on the complete experience of caring for patients in SPRs, including how employees are currently using the SPR technology, the benefits and drawbacks, any challenges, and employee suggestions for improving the SPR. We used thematic analysis to analyze our data. Across all 23 interviews, we extracted 1,369 quotes from the hospital employees. We then assigned 143 codes that best represented the data. Finally, we used an interpretive and iterative approach to group the codes into 11 high-level themes. Our method and themes are reported in detail in our paper. However, due to time, I will only be able to cover some of our most important findings in this presentation. For our findings, the first theme I'd like to highlight is that, just like the patients, employees have various preferred methods of controlling the smart patient room. For example, we saw how a nurse preferred using the wall switch since it was right by the door. Our rehab educator preferred the iPads since they are most comfortable using it. And on the flip side, some employees like OT3 won't use the iPad. He stated specifically, "I feel like the iPad is for the patient, not necessarily for me." IT1 provides additional insight why some employees don't want to use the hospital iPad. As he noted,
Just don't like having to touch or use the patient's iPad if possible, because it's kind of their property when they're here, and then sometimes people feel a little bit anxious when people like scrolling through their iPad when it's their information that's on there. So I prefer to use my own device.
So on one side, we saw how employees reported that the iPad was their primary method for controlling the room, basically using it as if it were standard hospital equipment. But if patients are encouraged to use the iPad as if it were their own by logging into their personal accounts, this creates tension when an employee wants to use the iPad to control the room. The patient may have sensitive emails or other content they don't want others to see. It makes sense. I'm sure most of us would not feel comfortable sharing our phone with hospital employees. The feeling would be similar if you're using the iPad with your personal accounts. Although the SPR was intended primarily for controlling the environment and entertainment of the room, we discovered that hospital employees are also using it as part of their workflow. As one speech therapist noted,
put it up with my laptop on the computer, on the TV, so they can actually see from the TV what their swallow's like. So it's way more convenient and a lot easier to get multiple family members involved with that too.
By being able to cast content to the larger smart TV, it helps the patient to be more engaged during therapy. So we know that employees are using the SPR technology for basic control of the room and as part of their workflow for therapy. What is the real impact of these rooms? The next theme I'd like to highlight from the study is that SPRs benefit patient-employee satisfaction. MD1 provided great insight into this.
But I think part of this is not just patient satisfaction and care, it's also staff satisfaction. So the thing I think about a lot now is sort of what can we provide that differentiates us from other clinical centers, that a staff member would enjoy working here more because of the technology. It made their job easier. It gave the patient more satisfaction, which gave the nurse more satisfaction to be a part of a team that provides that level of care. I think that's almost the most important thing right now that I'm thinking about.
As seen through our interviews, when the patient has more independence, autonomy, and control, it drastically improves their mental well-being and quality of life in the hospital. And since the smart patient rooms foster a better experience, it in turn impacts both patient and staff satisfaction. During the interviews, employees provided many ideas for ways the smart patient room technologies could be improved. As one example, they talked about leveraging automation with SPR technology. The psychologists provided a good example.
Certain TBI levels require different levels of stimulation to be productive. So if there were a way to this patient is on a green light on the protocol, if there were a room setting for that to automate it, I could see that being really helpful, because the different the different protocols involve different amounts of light, different amounts of volume.
There currently is no automations implemented in the SPRs at the NRH. However, since the environment and entertainment of the room can be controlled digitally, there exists opportunities to automate tasks in the hospital. Employees brainstormed other ideas for possible automations that could improve their workflow. These ideas concentrated on two areas. The first is automating the environment. For example, many employees like the idea of being able to walk into a patient's room and the TV volume goes down and the lights brighten automatically. This allows them to immediately begin working with a patient rather than having to do those tasks manually first. Employees also brainstormed ideas about automated charting. Many employees spoke about the burden of charting, how it takes a considerable amount of time. They liked the idea of the room being able to automatically chart easy tasks, like the time they entered and exited the patient's room, and the overall time spent with the patient. They even talked about automatically charting complex tasks, like tracking the patient's ins and outs. There are two other discussion points from the paper I'd like to highlight. First, we saw opportunities for expanding SPR utility from basic room control to therapy and rehabilitation. The SPR was used differently by employee type. The variation seems related to how the technology aligns with their particular job function. For example, physical therapists prefer using the specialized tools in the therapy gym over the SPR, while educators liked using the SPR technology for their patient education sessions. To maximize the benefit for all stakeholder groups, it is imperative to explore SPR technology further to see how it can be designed specifically to meet the needs of all hospital employees. The other interesting discussion point is that there are convergent and divergent interests between patients and employees. Both parties converge on the fact that the SPR can provide independence, autonomy, and control for the patient. This increased control is beneficial for both the patient and the employees. However, the most interesting example of divergent needs is the hospital iPad. On one side, employees reported that the iPad was their primary method for controlling the room. As stated before, the problem is that patients are encouraged to log in to their personal accounts. At that point, the iPad is essentially transformed from hospital equipment into a personal device. Yet, employees must use the iPad for some room features because there is currently no alternative. The NRH is actively working on a solution, but this example highlights the complexity of designing SPRs that support both patients and employees. So we have seen how the SPR can support patients and employees in different ways, but ultimately, who should it be designed for? Well, the answer is both. The design of SPR should not be an either-or scenario, but rather a blend that accommodates the needs of hospital staff and patients. This is achievable by implementing technology sensitive to both groups' needs. For instance, incorporating more therapy tools into the SPR would not interfere with the patient's comfort or control, whereas it could create a better all-around experience for both the patients and employees. Our research highlights the importance of adaptability in design. Not all patients and staff will have the same needs or preferences. Therefore, SPRs should be designed with flexible features that can be customized to suit individual requirements. This could include things like personalized room themes and user-customizable information displays. The smart room technology and UI should be intuitive and usable for both the hospital employees and for the patients. Quick access to patient data and room controls is essential for the hospital employees, preferably from a device that is their own control so as not to conflict with the patient's use of the hospital iPad. While SPRs in this hospital context are primarily used for patients to control their environment and entertainment, they also impact the hospital employees working in these patient rooms. Therefore, it is important to design future SPRs that consider and support all users of the space. The QR code is a link to our LabWare website where you can access the paper and find our other related work with smart patient rooms. Thank you.